7 years of grace, 7 years of making money, 7 years of togetherness. We are grateful to God. And like you said, health is wealth. And that is why we are here today. I urge everyone to listen and take it very seriously because it's important that we take good care of our health. And thank you, doctor that is on board. Thank you, Mrs. Victoria. We are waiting to get this knowledge. Thank you very much.
Okay, all right. Thank you so much, Dr. Benita. That's our director in Rems. She's handles our welfare department director. You have also on the call. I think before I end the class, after the end of the class, we're going to introduce all our directors on the call, our managers on the call, so that we can allow Dr. to just flow. So let me just allow do this honor to just invite on Madam Victoria. Is our HMO partner. From there, she'll invite the doctor. Then we'll take it from there. And the doctor will speak for a while. Then after, we'll take question and answer. Is that okay? Madam Victoria, please unmute yourself, ma, and have the
Good
floor.
evening.
Good evening, ma.
Good evening, everyone. Once again, on behalf of my company, My Cover Genius, we are saying congratulations on your anniversary. We pray that this is just the beginning. More greater heights, more good news, more sales, more happiness, more togetherness, in good health and sound mind, in the name of Jesus.
Amen.
Okay, in order not to waste our time, my name is Victoria Jachibo once again, and I'm the regional manager sales for My Cover Genius Lagos. And I have with me our doctor, our one and only doctor, Dr. Babajide. Doctor, you're welcome. I'm sure that you're going to make all of us happy today, like you've always done. Welcome to today's health talk. You may proceed from here. Thank you.
Doctor, you can unmute yourself, sir. Is it there? Let me check him again. Dr. Baba. I think it went out. I think network kicked him out.
Okay, let me call his attention to it.
Okay, I think it's back now. Doctor, can unmute yourself.
Right.
Unmute yourself, sir.
Hello, I apologize. My network
Fantastic.
cut off. Can everybody hear me?
Fantastic. Doctor, are you going to show a slide? Are you showing some slides? Or no need for that?
Yes, I'm going to share some slides.
So
and
you have the authority to do that. I'll make you co-host.
Okay, wonderful. Thank you.
Thank you.
I'm going to have to join with another device to share the slides. Give me a minute.
Oh wow.
So
Then we can't see the slide then. We can't see it from here.
not on this device, no. I'd like to quickly. Can I join with two accounts? I believe that's
Yeah, but
possible.
just have to mute the other one. Just to mute the other one so it don't have an echo voice.
Okay, of course, of course.
That's fine. That's fine.
Okay.
So while we
Okay,
wait,
give me a
please,
minute.
members, invite your colleagues, your friends quickly right now. That was set up. Call your team, choose over your teammates, invite them to join. Your Madam Adepeju, invite your teammate to join right now. Everybody, your teammate to join quickly, please. All right, let's get this house filled up. Invite. I'm sure you have a group for your downlines. Go and pump the group. Go and call the group. Let everybody wake up and join this call. Health is wealth. All right, everybody, quickly do that.
Okay, it appears that you have to.
Okay, doctor,
Hello?
you want to send me the slide on my WhatsApp so I can share it from here? Is that okay?
Okay, yes, that's lovely.
I'm sharing my WhatsApp number right now on the chat room.
Okay.
Is that okay, sir? Have you seen my other number, sir?
Hold on.
I private
Yes,
chat you.
Yes, I have.
Fantastic.
Wonderful. Okay.
Or you want to do email? Is it email easy for you?
Yes, email might be better.
Fantastic. Let's do email faster then. I'm browsing my email right now also.
Sorry, you're breaking off again. Hello?
Okay, so I'm sending my email right now.
Oof,
Email address.
the dangers of the internet.
So I've sent my email right now, sir.
Okay,
Just
wonderful.
great.
I'm
So
just gonna
waiting.
send it to you. But anyway, before technology gets the best of us, hello everybody. My
Yes,
name
sir.
is Dr. Babazide Oyekunle. It's so lovely to be part of this anniversary edition of your call. It's lovely to meet you all. I, what am I? Again, I'm a general practitioner right now. It's an advanced trauma certificate, but I'm very passionate about making sure people don't die, right? And hello, can everybody hear me?
Your voice is a bit low, sir. Sorry, sir. It's a bit low. Can you amplify a bit?
Okay, I didn't catch that.
Can you amplify your voice a bit, sir?
Again, I didn't get that. You know what? I'm going to move away from my current area to
Okay. I was saying your voice is a bit
ensure
low.
that, because I think network is a bit to blame for whatever we have now. Can everybody hear me now? Is
Yeah, I
it
can hear you
better?
now, but it's a bit low. Your voice, amplify your voice a bit, sir.
Is it better?
Yeah, improving. Thank you, sir. Improving.
Okay, lovely, lovely. How's now? How is it now?
Yeah, quite. I think quite better now.
Okay,
So
that's lovely.
we're still waiting for
So,
the email address, the email.
yes, yes, I'm trying to send it, but the same network that has been disrupting our.
Oh, so sorry about that.
Oh no, it's okay. But before that, like I said, we shouldn't be handicapped by things that can't speak.
Yeah, it can flow.
Anyway, uh, yes. So the topic for today is hypertension and diabetes, and um, getting getting ahead of it in people that are in their 30s or above 30s, right? Now, this is a broad range that involves people in their 30s to 50s and ongoing. I'm sure that the Rems group has people of all age ranges in
Yes.
here, and so everybody will benefit from this. Now, first of all, hypertension is defined as sustained high blood pressure, right? It just means raised blood pressure, right? And diabetes is what Yoruba people call ito sugar, okay? It means for one reason or the other, glucose or sugar is not getting metabolized in the body as it should be. But we'll start from hypertension. High blood pressure, right? Wow, and my slides are here. It's so ridiculous. It is absolutely ridiculous what is happening. You know, I can share from this, I'm going to try to share from this device so that everybody doesn't miss out
Okay.
on meticulously prepared slides. So, like I was saying, high blood pressure or hypertension, it is sustained increased blood pressure over a particular over a particular range. Now, the usual range that we like, that doctors are comfortable with, right, is 120/80 or 120/90. That's 120 being your okay. Can everybody see my screen now? Hello.
Yes, yeah, I can see your screen. Well,
Okay.
you're not seeing the slides yet.
Okay, that's
Yeah, it's
wonderful.
showing now.
At least that's
Fantastic.
okay. Wonderful. Wonderful. So it's managing high blood pressure and diabetes in adults over 30, right? Now, hypertension and diabetes, like I put in the slide, they often occur together. Okay. Now, people in medicine often say that God is not wicked, but we see sometimes that diseases that help themselves to debilitate the human body often, work hand in hand. And these are, this is an example, but we'll start from hypertension. But just as an overview, both of them are major risk factors for heart disease, okay, stroke, kidney failure. Now, the thing that a lot of people do not understand is for hypertension, and a lot of Nigerian adults are guilty of this, and this is just to digress. For instance, people think, oh, when they see their high blood pressure or the blood pressure that is high once, right? They take a drug once to suppress it, and it goes down, then they're fine. That's not the way hypertension works. Sustained high blood pressure doesn't just happen once, right? It doesn't just affect you in that one instance. No, it is drawn out over a long period of time, which the blood pressure is hitting your organs, like your kidneys, like your heart, like your brain. It is hitting the vessels and it is damaging them slowly, which means that you're more susceptible to things like strokes, okay, even brain disease, right? Some brain disease and kidney failure, because your kidneys are being hit over time. It's like somebody continuously punching your kidneys from the inside, okay? Micro punches, but then you can imagine the type of trauma that the disease can affect over years. Okay, that's why people often think that, oh, that one instance of 150, 100 blood pressure, and that they quickly took a drug and it went down, and they never took their drug again. They think that's fine. That is not fine. Okay, but we'll get there. We'll get there. Now, early management after 30 prevents long-term complications. Now, it's very important, particularly in the case of hypertension, because most people often think that it is a disease of the elderly, right? But nowadays, we often see that, or it is not strange to hear that young people have strokes or heart attacks or slump and die, right? Now, there may be some family background to it, but it happens. Is everybody following me? Right. So everybody needs to be on guard. We need to be proactive. Right? Most people under 30 or just above 30, they've never checked their blood pressure before. They don't know what it feels like to look at that machine or to be told, your blood pressure is so and so. It doesn't compute for them, right? And that is it's a bit dangerous because it's in that young age that you start to, let me say what the Gen Z say, you start to grind, okay? You start to grind and you ignore everything. You put your body on the line to make money, right? And these things count. It counts. Your body will start to tell. And one of the indicators of failing health or of you pushing yourself is your blood pressure. Okay. So the risk factors for high blood pressure: family history, right? Obesity, high salt intake, stress, and sedentary lifestyle. Now, these are the major things. Family history. If your family has a history of hypertension, most likely you should start monitoring quickly. Or if there's been a history of stroke or cardiac disease, these things it's very important. They are markers, they are highlighters to the danger sign that may occur. I hope we're all following. Now, obesity. Obesity is usually it's if you see one thing that is almost one size fits all for every disease, obesity is it, right? Once you are, once you have enjoyed life a little bit too much, right, it's quite likely that you're susceptible to all diseases like this, like diabetes or hypertension or some autoimmune diseases, in fact, right? Or diseases like sleep apnea. It's just obesity is it's a very modifiable risk factor that people don't really take note of in this environment because a lot of Africans are large, right? And it's a sign of good living, but some people have overdone it. Anyway, high salt intake in processed foods, I would say. because most of our own foods, yes, we like salt, right? But we also eat a lot of vegetables, and we put things to taste. But processed foods like Pringles or snacks, the consumption of these things and their high salt content, it will tell on the body. Now, stress. I know people say that, and it's true, thinking doesn't cause hypertension. Your people say, what's wrong with you? No, it's not that, but stress on your body, working yourself, right? So that's a line to take. Now, sedentary lifestyle means a type of lifestyle where you sit down for too long, less physical activity, right? And we tend to see this in people, and this is like a double-barrel sword. Again, can everybody hear me? So I know that the network hasn't vanished.
Yes, I can hear you very clearly, sir.
Okay, lovely, lovely. Thank you very much.
But your
I'd
voice is
like
a
to
bit
be.
low.
Oh, okay. Okay. How's
Amplify.
this now? Is it better?
Fantastic, fantastic.
Okay, wonderful.
Thank you.
So I was saying that sedentary lifestyle, again, this double barrel thing, when people advance in age, they are more successful, right? And because they are more successful, their positions in their workplaces often require them to not use much of their body, but more of their brain. So they are sitting down more, right? So the double barrel thing of being older and then sitting down more, right? And then they're not getting any of the activity that they often used to get, and it is counting. They're not walking around, they're not jogging, they're not doing any form of exercise or, joining country clubs and playing tennis. They're not doing all of that. So that is a sedentary lifestyle. The more you sit, right, the more you are in danger of these diseases. In fact, the faster you get, really, because of lack of activity. And we know that obesity is that um, is a risk factor for hypertension. Again, now the type of diabetes we're going to focus on today is type 2, because we're focusing on diabetes in people above 30. If type 1 diabetes, also known as juvenile onset diabetes, is due to something else. It's it's your body um, destroying the cells that produce insulin from when you're a child. Okay, so your body just has an autoimmune condition, and your body just, destroys the islets in the pancreas, right? And that is a condition that is apparent in young people. So they'll start managing the disease from young, right? From the juvenile age. But this one, the one that may be apparent or that may come, the adult onset diabetes, is diabetes type 2. And this is it is known as your body not responding anymore to glucose, or sorry, to insulin. So your receptors are tired, all right? Are tired. So now there's family history, obesity, okay, also a risk factor, poor diet, physical inactivity, and age above 30, right? So these things, the risk factors are similar, and so they come hand in hand. Now, the range for hypertension is blood pressure above 140/90. And this is not, oh, you see 140/90 once. No, no, no. You have to measure it on more than two occasions. So you can measure it on more than two occasions a week apart. Okay. So once you see that the rate is sustained, 140/90 or over that for more than twice, it's okay to assume that you have high blood pressure, you have hypertension. We will start talk to your doctor. Now, diabetes is more of it's a slower thing because you don't most people don't like getting pricked, right? To check your blood sugar, it will take your blood. I mean, it is blood sugar. So fasting glucose, right, greater than 126 milligrams per day. Don't worry. When you go to the hospital, your doctor will explain it. Or HbA, we call it test HbA1c, which measures the level of glucose control in your body over 3 months. Now, if it is over 6.5%, right, that diagnosis can be made. Or if your random blood glucose, like say, I just take you now, anybody in in the chat room currently, or anybody on the call currently, you've had a long day, you have eaten, you're taking juice, you're taking water, you know, I just take one of you now. But if your blood sugar is above 200 milligrams per DL with symptoms, then we can reliably say that you have diabetes. Now, I'm not going to go into the nitty-gritty of the medicine, but there are certain things that we can do to manage it. All right. First and foremost, get diagnosed. I believe that everybody can go for checkups now. Okay. Everybody above 30 can go for checkups now, get diagnosed, know if you have these things. And if you have a family history, it's more of a fire to your feet to get diagnosed, to get checked. Okay. If you're if we're in the green, in the safe area, right? We know that, okay, what we have to do is maintain our safety, which is exercise and control diet. By control diet, I mean eat more fruits and vegetables, reduce salt intake, and exercise brisk 30-minute walks every day. Wonderful. In fact, that is also the first step to managing mild hypertension. But again, the management, lifestyle management is the cornerstone of diabetes and hypertension management. It is the cornerstone. Okay. There's something called a DASH diet. Don't worry, you can see me later. But then it's in the purview of the dietitians. We work hand in hand with the dietitians to provide these things. Then reduce salt intake to less than 5 grams a day. You need to cut out refined sugar as well. By refined sugar, we mean like snacks. People love candy, and it's amazing because yes, candy is meant to be loved. So chocolate, candy, Coca-Cola, and things that are not particularly organic, right? I apologize for that intrusion. Yes, things that are not particularly organic, these are refined sugars. So it's very it's very important. Sorry again. It's very important that we make sure that we cut that out of our diets. Now, oh sorry, you can't see my screen anymore?
Yeah, it's not no more. Yeah, it's back now.
Okay.
It's
Okay,
back.
wonderful. Uh-huh. So, yes. Then weight control, naturally. If there's something called BMI, body mass index, right? It's how we track if somebody is in the normal weight range or if they're obese. That is the measurement of it. Now, usually the normal weight range or the normal BMI is 18 to about 24, slightly less than 25. So anybody that is within that range. Now the BMI is, yes, is measured weight and height, okay? Those are the parameters needed in measurement. So if your weight and height do not correspond, you're said to be either underweight or in or overweight, right? That's how people get the different grades of obesity. Now, if the BMI is less than 25, good. That's why to control these things, exercise is one of them. Even if you're obese, we can cut that down, okay? Exercise, again, is a cornerstone. Now, 150 minutes per week of moderate activity, it ties into the 30 minutes of walking per day. It doesn't hurt. It just brisk walking, 30 minutes every day, dedicated, and you will notice the difference in your health in about 2 weeks to a month. It is almost remarkable. In fact, it's not almost, it's quite remarkable. Now, another slight evil in our climate is alcohol, right? And it's tied with his elder brother, smoking. Smoking is linked to so many things that I wonder why people still look at cigarettes. But the enjoyment of life is one thing to another person. Anyway, smoking can be tied to diabetes, hypertension, several cancers, right? And chronic obstructive pulmonary disease as well. And so, therefore, in this particular case, quitting of smoking, not even reducing the number of packs smoked, quitting smoking will go a long way in the management of these two fraternal diseases, right? And then limiting alcohol, you can taper it down no matter the consumption you're taking at the moment. So you you're taking 5 bottles, limit to two, and start thinking of, not even drinking alcohol at all. Because once you've gotten the diagnosis of a disease like this or of diseases like this, particularly combined, you need to um, note what you want over what you like. Do you want to live? Or the things you need? Yes. What are the things you want? You need to be alive to enjoy life in some other way. You need to be alive to take care of your children. You need to be alive to enjoy your money, right? So these things are hindrances to life in particular. Then stress management. A lot of people, as they grow older, they lose the ability to sleep on time. They lose the ability to find rest because they put their bodies through so much that it's not used to finding sleep easily anymore, right? And sometimes when older people wake up, they can't go back to sleep, no matter the time they wake up. So there's something called sleep hygiene that will definitely help you. Sleep hygiene is making sure that your bed is sacrosanct, okay? Your room is not, or your bedroom is not the same place you read. It's not the same place you eat. It's not the same place you press your phone, okay? It is you keeping your bed just sacrosanct for sleep alone. When you get to your bed, it's sleep time, okay? No matter how long it takes, your body will start to adjust. That is the basic tenet of sleep hygiene. Now we're going to go to the medical management of these two diseases. Now for hypertension, usually the first line drugs are ACE inhibitors, right? Calcium channel blockers, and thiazide diuretics. But I'm going to put a caveat. Because we are black, right? Research has shown that black people respond more to starting calcium channel blockers than to start ACE inhibitors. So what black people do, or what we do in this climb, we first start a person on calcium channel blockers like amlodipine or nifedipine, right? I'm sure that a lot of people are familiar with those two drugs. There are lots of people. In fact, I believe some people are on it now. Amlodipine 5 milligrams, amlodipine 10 milligrams, you are familiar. Okay, that is the first thing we start people with in this climate. And then we can add on the drugs according to how your doctor sees your blood pressure being controlled, right? So these are the basic drugs that we use. Now, the target blood pressure we're going for is usually under 130 systolic and 80 diastolic, right? Especially if the fellow has the combination of diabetes as well. Now, the medical management for diabetes is under a unit called endocrinology, right? So naturally, we don't just over-the-counter prescribe diabetes medication, okay? The first line for it is called metformin. Metformin, this may, you know, it's the most common and it works wonders, right? Now, if metformin is not getting the sugar there, there's some other types of medications you can use, DPP-4s, the SGLT2s, especially if, there's a cardiac or a renal comorbidity, all right, or yes, comorbidity, or if there's a background illness in those two areas, yes. So the HbA1c targets, that's the 3 months sugar target I explained, should usually be less than 7%. Now, monitoring and follow-up. This is a very important aspect of it, right? It's you can't just take your blood pressure drugs for a month and say, "Oh, I'm cured," or you take your diabetes drugs for a month, you see results, and you say, "Oh, I'm cured," and then you never take it again. No, these are lifelong manageable illnesses. Okay, so when we manage, we should also follow up. Okay, follow up with your doctor. It's very, very important. Follow up with your doctor, follow up with your healthcare provider, so that. And one thing I've noticed in the Nigerian climate, because if you're in the field, you notice is a lot of people start medication, see the difference, and then they stop. They stop because they say, "Oh, I'm healed," right? And then they start to feel some type of way a few weeks later. They check their blood pressure and they see that it has gone up, and then they resume the blood pressure medication or they resume the sugar medication, right? Now, for high blood pressure, the same degree or the same dose of medication you were using before you stopped may not be able to control the high blood pressure anymore because your body gets used to it. And that's what a lot of people do not understand. Your body gets used to the dose of antihypertensive that you're using. So if you're using 5 milligrams uh, of amlodipine before and you stopped, you went to play for about 3 months, and then you notice that your BP was rising, you will start 5 milligrams of amlodipine again, thinking it is doing the exact same thing and is suppressing it as adequately as it used to, but it is not, right? And because you will not check, you're not doing follow-up, more danger is being done. You're doing half work, right? And that is very dangerous. It's very important. I am very certain that there's somebody in this on this call that has done that exact same thing. I need you to repent. Okay? I need you to find your doctor, check your blood pressure, and start resume your drugs and know that you are not stopping anymore. Okay? Now, naturally, some drugs have some side effects, and I believe that everybody's physician will be able to, because there are many things that some people don't like. So, amlodipine sometimes causes ankle swelling. Okay, and so there's some things that we can twitch or we can switch. Just make it milder to accommodate the drug presentation. Some drug side effects, like ACE inhibitors, for instance, you may be a cough associated with it. We'll just switch it to an ARB. Okay. Now, diabetes management, right? Uh, for diabetes monitoring, the HbA1c, okay, should be done every 3 to 6 months. And then we need to check your eyes and kidneys as well to make sure that everything is on the up and up. Now, also, yes, we screen for dyslipidemia to ensure that the good cholesterol is good, the bad cholesterol is low. Okay. Now, patient education. You're not my patient yet, and that's why again I love this. Prevention is always better than right. But usually when they come to us, we teach them that yes, you need to self-monitor blood pressure, you need to self-monitor your glucose. That's why everybody at home should have glucose machines and blood pressure machines. So you can know and you can keep a blood pressure diary so you can show your healthcare provider, right? You need to adhere to medications. It is very important that you do not start and stop as you feel like it will not have the same effect. Now, with people that are using diabetic medication, it is very important to note the warning signs like hypoglycemia. You need to note when you're sweaty, when you're weak, when your head is swimming, when your vision is blurry, when you are shaking, right? These are signs of hypoglycemia. These are signs that you're taking medication, but your sugar is still not high enough, right? Your sugar has been suppressed too low by the medication. So you need to get some sugar in. You need to take a bottle of Coke, some juice, some sugar to make sure that you do not collapse or you do not fall into a coma. Okay. Now, hypertensive urgency. This is why it is very, very important to continue checking your blood pressure. Because if you see a rising trend in your blood pressure, you can easily get it checked. Hypertensive urgency often happens when a person is not on top of their blood pressure checks, right? It just means that the blood pressure is very high with symptoms. It's high like 170, 110, or 200, 120, right? And they're getting signs like headaches, or they're getting arm pain, or they're getting blurry vision, right? These are very important things, and you need to present to the hospital immediately. In conclusion, like we always say, prevention is better than cure. Your lifestyle now is the foundation of not getting these diseases or managing these diseases properly, right? And naturally, medication is individualized. That's why we want you to come to the hospital so we can check what works for you and what works without side effects or with little side effects. So we can make a very individualized cocktail to ensure that you live a great life, right? Now, Regular monitoring prevents complications, and we are a team. It's very important to know that we are a team: patient, doctor, nutritionist, and the patient's family. Everybody's in there to make sure that everybody is doing well and alive. Thank you very much. I have been Dr. Babajide Oyekunle.
Oh wow, that's one of the best lecture I've received on this topic so far. And was my grandparents were and they have both had diabetes, and I was following them. I was kind of managing them myself. But so far, I've attended different lectures and seminars, but this is quite in depth and quite clear. Thank you for that, sir. Thank you for that. If I say I've lectured to several lectures on this, I have, because my grandparents, both of them, grandfather, and grandmother, they had the issue, and I grew up with them, and I was also like the PA, carried them up and down. So my grandfather retired from Chevron, so Chevron does seminars every now and then. Thank you so much, Doctor, for this um, in-depth and basic, clear knowledge on this. So, guys, you have any question for our doctor? Quickly, raise your hand, and I will mute you. Please, your questions should be tied down to what you're talking about right now. Yeah, if you want to talk, and put it on the chat room, and we will read the question for you. All right. So, okay. So someone is saying hypoglycemia and low BP. How do you rectify it, doctor? Dr. Yokule, you have questions for you, sir. You can meet yourself, sir.
Yeah, okay. Hello. Hypoglycemia and low blood pressure.
Sir, we lost your voice, sir.
Hello, can you hear me now?
Beautiful, yes, sir. Thank you, sir.
Okay. Now, hypoglycemia it just means low glucose, right? The thing we do with low glucose is often as a result of you using medication, right? Diabetes medication and not eating, or using the wrong dosage, overdosing. That would just drop your blood glucose. So what to do? Like I mentioned earlier, you get a bottle of Coke, you drink about half, you notice that your symptoms are they're going or they're gone. The symptoms of shaking, the sweatiness, the weakness, the hunger, headaches, it's gone. Okay, but you need to note those symptoms and you need to know them for what they are. Right? Now, low blood pressure. This it depends on the context. Low blood pressure is usually defined as blood pressure with a systolic below 90, right? Diastolic below 80. Oh no, diastolic below 60. So 90, 60, that's borderline. Below that, that's low blood pressure. In fact, that's shock, right? So you want to make sure that your blood pressure revolves around 110/90 or 110/80. Now, if you notice that it is below 100, right, you need to drink water. Drink 1 liter of water and check again, right? Has that question been answered? And then, of course, you need
Yes.
to go to the doctor.
Okay, fantastic. Please, every question should be related to today's topic of the day. All right. I'm going to just allow this one pass. Someone asking, please, I have been feeling some pain in my right arm and some slight headache. I went for checks and I was prescribed also medication for me. I don't know if that's the right medication, sir. This is not general practitioner topic. It is a topic for diabetics and
Well,
IGP. But doctor
well,
can
yes,
answer that.
but we can
Yeah.
still make sure that everybody gets proper healthcare. Now, it's the people that have examined you, right, that will know. That's why it's very difficult to do online consultations because you
Yeah.
cannot see that patient. You can touch and feel that patient, right? But pain in your right arm and slight headaches, and they're giving you some medications. Also, it's a gastrointestinal um, illness. Okay, so if you have had gastrointestinal symptoms like pain, and then they have checked and they've done the urea breath test for you, or the blood antigen, and they've seen H. pylori, yes, um, the Alzheimer's medications are the right way to go, right? But I can't tell because you haven't told me that you have abdominal symptoms right now. And I also cannot see you. Like I cannot physically see you, right? But since you've been having some pain, I suggest that you complain about the pain to the doctors. They will give you some painkillers. If it persists, they will do some more tests. Is that fine?
Fantastic. Thank you so much, sir.
Okay.
Someone's asking also that, okay, well, because I don't want to keep taking my drugs. Can I do Monday, Wednesday, and Friday?
Please don't now. Ṣebí mo ti ṣàlàyé, you cannot do that. You can't do that. You can't skip drugs. It is very, very bad. Because as I explained, your drugs, you will get used to them. So it's like you're putting a pillow on something, on a spring, and you remove the pillow and you go and play for a while, right? That spring gets back to how strong it was most of the time. So the same force that you were using to press it down with the pillow, it won't hold it anymore. And you will have resumed medications. You think that, oh yes, my blood pressure is still controlled, and you won't check because the same person that defaults is usually the same kind of person that will not check their blood pressure. Okay, so you won't check, but damage is being done. Are we clear? So please
Yeah.
don't skip your blood pressure medications. If you have side effects, please see your doctor. I know some people say that they have headaches, they feel woozy. It's the medication. They can tweak it. They can reduce the dosage. Something can be done. They can change it. Okay. So please,
So, what are you saying? Is it reverse? Are you saying it's irreversible?
what do you
Like
mean
for
by is it
like
diabetes?
pre-diabetes? If you have pre-diabetes, is it reversible?
Oh, prediabetes. We mentioned it. Again, lifestyle is the most, it's the easiest, it's the most basic way to get ahead, right? You need to control your diet, you need to start exercising. So you notice that your blood pressure is, sorry, you notice that your blood sugar is under control,
Under control,
right? And
normalized.
you just, yeah, exactly, it's normalized. You just need to sustain those activities. It's the thing that causes it that will sustain it, or the thing that bursts it that will sustain it. So once we start living healthy, sure. And please stop smoking. Whoever is smoking, stop smoking because it can affect your pancreas and that will lead
Okay.
to, yes, some other comorbidities.
Mm.
Um,
Someone's asking why does blood pressure still go high when a diabetic patient does not eat as much and or during intermittent fasting?
yes, your body is reacting to the lack of food. So
Mm,
people think um, that not eating will solve the problem. No, you need to eat the right things in the
mm,
right quantities at the right time. Okay.
okay.
So it's not that, oh, your blood sugar is very high. I'm not going to eat. No, your body reacts to hypoglycemia by releasing some things, right? It breaks down fats in your body. There's glycolysis and there's gluconeogenesis. These are just terms, right? But it just
Yeah.
means that glucose is being taken, it's being formed from other stores in your body. So you that you think you are shocking your body by not eating, it will shock you. Okay. Yes. So your blood pressure remains high during those times because you're not giving it food and it is forced your body is forced to make do and it will do yama yama.
Yeah.
Okay. Exactly. So we need to maintain the diet. Um, how can I treat neck spasm? And
So
what is the
just
cause of neck
just
spasm?
can you just skip that? Let that pass because that's not part of our question today.
Okay.
Let that pass. People should let to follow instructions. All right. So Jenny, can you recommend? Well, I know that's the dietitian's work anyway. Because you're talking about
Yes.
diet and all that. So maybe we
And
can
that is a dietitian's work.
reschedule a meeting for a dietitian to come and talk to us again. Maybe hopefully.
Sure, sure. In fact, that would be so lovely. So that you can have
Yeah.
um
Because
the full
our people
complement of
are
medical.
our people are most people come from 35, 40 upward. Most of our people. So I guess majority need to be careful right now. And from my observation, part of this world, we're kind of victim of this high sugar, cholesterol, and all that. The food we eat and all that.
Mm.
Yeah, so we have to be
Yes.
careful. You have to be careful. Another question. Please don't tell me the question directly. Can you put it on the chat room? Like that, the question directly on my WhatsApp. Okay, someone's asking, um, I'm feeling pains in my eyes and I I'm taking my drugs. Why do I still feel pains?
Why do you still feel pains?
Yeah.
Are you using your glasses?
Okay, I have to ask the lady. Lady, are you using your glasses? Can you respond? That's a big question there. So,
Yes, so it often happens that some people don't use their glasses properly or they're using the wrong prescriptions. So again, that is not it's not really my purview, but you need to make sure that you get because diabetes can also affect your eyesight. So you make sure that you get all these things checked. Diabetes, hypertension can affect your eyesight. So get your diabetes test done, get hypertension test done, okay, and make sure that you see the ophthalmologist. If you use your glasses, make sure that it's not that you have an incorrect prescription or you're not or you're misusing your glasses. Okay?
okay. All right. So, why do you always feel weak every morning?
Week
But
every morning.
yeah, almost every morning I feel weak to get out of bed, even though my blood pressure is sugar and pressure is under control.
It's under control. Well, it might be due to another thing. I recommend that you go to the hospitals, check if it's not something like polymyalgia. Does weakness come with pain? Does it get better throughout the day? These are the questions that a doctor will
Okay.
physically ask you. Okay, and then they'll do some tests because there's a wide range of things that may be going on. It might be myasthenia gravis, it might be polymyalgia rheumatica. You might have a rash that you don't know, and it might be polymyositis. It might be that your muscles are aching. So there's a wide range of things that I cannot tell you over the phone. Okay.
Dr. Kunle, you're giving us big grammar, so those terms are powerful terms.
That's why I'm a doctor, sir. That's why I'm
I
a
can
doctor.
imagine. Yeah, respect,
Uh,
sir. Respect.
Thank you very
I
much.
guess any more questions before we allow Doctor go for tonight? Any more question? Any more question? Put in chat room. Also, you want to just show the Mr. Lek explain a message by answering this question if you don't mind.
Okay, yeah, you can text me.
How best can I treat neck sprains? What is the cause of neck sprain? I don't know what that means. I thought you are muted, sir.
Yes, I'm trying to reply him.
Okay. Let me check the chat room for any question again in the chat room. Okay. Is it okay we have the slides? Is it possible we have the slides?
Um, okay, but I don't usually give that out, particularly
Yeah, of
to
course. Yeah, I don't think.
non-medical professionals.
Yeah, I agree with you, sir.
Yeah.
And
Any other questions?
okay, so in the slide you mentioned sugar intake. I can eat without so salt. I can eat without salt. I don't understand. Is it
Oh,
possible to eat without
no,
salt?
no, no, no. Oh, yes, it's very possible. People do it all the time. But I'm not even saying eating without salt. I'm saying reducing the intake, right? So you can visibly, or yes, you can visibly reduce what salt intake looks like for you, not for your entire family, but for
Okay.
you, right? To make sure that you can have your foods cooked without salt, okay? And it will
Wow.
still be tasty. Yes, this is where
So
dietitians come in.
not a Nigeria of today. Not cook separate pots. Family house.
Yeah. Yes, that these are concessions that are often made for people living in the United
Exactly.
States.
I
Exactly.
agree
So
with you,
yes,
sir. Okay. Someone's asking, I have pains under my feet. What can be the cause?
again, it could be that you're wearing the wrong shoes, right? It could be something called motor neuroma. It could be pla- plantar plantar fasciitis. I apologize.
Yeah.
The terms got mixed up. Plantar fasciitis. It could be a range of things, right? But first, have you used paracetamol and it did not go? Second, are you wearing tight shoes? Or are you wearing high heels? These are things that the first things we should, do are the simple things. Okay? The very simple things.
Okay,
Let's
so
let's make sure that's
people are talking now.
yes.
Fantastic. So if one has diabetics, must the person also have high blood pressure too? Or is it vice
Sorry,
versa?
I lost you there. What was the question?
Okay, someone's asking if someone has if one have diabetic, must the person also have high blood pressure too?
No, it's not a must. It's not a must. I'm just we're covering these two because they they are it's very common to find them together. That's how I would put it. It is very common to find them together. So that when we find one, we often look for the other. We're happy when we don't find it, right? But we often look for it. Do you understand now?
Okay, sir. Yeah.
Yes.
So I'm seeing one Dr. Olasumbo. Can you unmute yourself and ask a question? Your questions have some terms I don't understand. Are you a medical doctor or a doctor for your career doctor? Let's
This
know.
is an academic. Good evening. This is an academic doctor. Thank you for the
Fantastic.
opportunity.
All right.
My question is when the lower part of the BP measurement is usually higher than the upper part, diastolic and systolic. I'm not too sure if I'm getting it correctly.
Sorry, are you
But
saying the diastolic is higher than the systolic?
the lower one is higher than the upper one. I don't want to mix it up. Diastolic, systolic. I'm
Sorry,
not
I
sure
didn't
which
get
one
that.
is which
The
is
one
which.
under, the one under
Yes, is higher.
is higher
Like
than the one on top.
yes,
I
like
see.
129.95 or 134 101.
134, 101. No, the systolic is
Yes.
still higher. The one on top is still higher.
Oh, yes, but yes, it's still the lower part is on the high range, while
Yes, yes.
the upper one is in the normal range.
Well,
Okay. Thank
actually, I
you,
wouldn't
sir.
say the upper one is higher.
That's
Sorry, I wouldn't say the upper one is normal. So there
okay.
is, from what you've described, right? The term you're describing could be isolated diastolic hypertension, and that is an interesting case I would want to look at in the hospital. But if the diastolic was 110 and the high one was 135, it's still not as commensurately high as it would be, right? But it's high
Okay.
nonetheless. So that is
Okay.
still hypertension, and we'll treat it as such.
Okay.
Okay. Yes.
Okay.
Fantastic.
Thank you.
Thanks for that. All right. Okay. So any more questions, guys, before we call it a day? Any more questions? So, Doctor, we'll give you the room to do a final summary and maybe action points that we can start
Sorry, I
taking.
didn't catch that.
Oh, before we round up, I'll give you a chance to give us a summary of the talk today and action points for us to start working on. Is that okay by you, sir?
Hello? No, no. It's funny how I did not get that. I just got hello. So you give
Okay,
me a few
so
points to do what?
I'm saying that before we're about to round up right now, so I wanted to give us a summary
Yes,
of today again, then action points to start acting on to help us also.
I see. Okay, so
Yes.
summary. Hypertension and diabetes will prevent you from enjoying life. Okay? Disease, if not prevented, will prevent you from living. So we need to prevent. If it can't be prevented, get on top of it early and manage it on time. Okay? And consistently. Consistent management. Now, exercise and lifestyle are the first port of call. Even if you're on medication, the if you do exercise to support it, you won't need to do as much medication, right? And your body will start getting healthier. Okay? Remember that lifestyle, diet, exercise, important, very important. And I cannot overstress how important it is to stop smoking. Thank you very much. Now, action points. Again, exercise, diet. Simple, simple things.
Fantastic.
Yes.
Come on, guys, let's drop some emoji in the chat room. Emoji, emojis. Thank you so much, Doctor. Thank you so much, Dr. Oyekunle. Babajide, I believe. Yes. So I don't know if Madam Victoria has anything wants to say before we allow our directors to respond to today's training. For me, it has been mind-blowing and quite insightful. Thank you so very much once again, Doctor. Madam
Thank you.
Victoria.
Um, I don't have any other thing to say. Doctor have said it all, so we just have to. Yes, it's not going to be an easy one, but we'll try.
Yes, sir.
Considering the country we are, we'll just try, and God will help us.
All
Thank you,
right.
everyone. God
Okay,
bless you.
so I wanted to ask, can we get a follow-up with a dietitian, if possible? We can talk about that later on.
Yes, we can. We can talk about that.
Thank you so very much for the time. So I want
Thank
to
you.
give an opportunity to we have on the call right now. I can see two directors on the call. That the Barrister Da, Rems Company Secretary is on the call. I can also see Dr. Benita on the call. So, Madam, any few words from you, ma'am, before we give the floor to Madam Benita to give us the final remarks. Madam Da, are you there? Barrister Da, can you say some few words? If she can speak where she is, unmute yourself, ma'am, if you can. If you can't, then I'll just allow Dr. Benita, who is also our welfare director, to closing remarks and give our members instruction as our welfare director. You have the floor, ma. Dr. Benita. You're breaking, ma.
Thank you, Pastor Bobby. Can you hear me now?
Yeah, fantastic. Yes, ma.
Okay, thank you very much for coordinating this. Dr. Oyekunle, thank you so much. You killed it. Simple words. And in fact, I know that a lot of people that need it will begin to work towards it. And I'm so going back to my early morning workout.
I'm guilty.
I'm so going back. Thank you so much. We appreciate this. Even when we called you people at a very short notice, you came up very prepared, and we've learned a lot. Thank you very much.
Seriously.
Thank you, Madam Victoria, for putting up this together in that short while. We appreciate you all. And for Rent Nation, I want to quickly let you know that for this HMO, you can come on board. It's actually cheaper to come on board on HMO. So let us know, chat me up. Let's help you come on board so that you can have the opportunity to talk to the good doctors and ask all your questions, because we can't cover everything. And for those who will watch it later, this is for you too, so that we have good
Fantastic.
health. As we make money, let's live healthy. Thank you so much.
Beautiful. All right, everyone. So in case you're joining late, don't worry, don't worry. We'll send a replay to the group tonight, so you can watch, you can listen to the replay, and learn from it. And if you're not already under even though yes, the HMO plan, we're using the test running with our staffs and some few members. So if you want to get on board, get in touch with the office, the admin. She will tell you how to get on board and can list you all together, of course, not for free, with a fee. All right. Even though yes, coming through Rems is subsidized, certain it be subsidized. So, all right. So you need to get on board on HMO. It's very important. Health is to say is wealth. So, thank you all again for finding time to be on tonight, and let's be in the mood of celebration. And of course, I don't know if I'm going ahead of myself. The big celebration coming up December. December, I'm going to have a big party. So I'm giving you expo. Don't tell anybody thought about this one between me and you. My is not hearing us. Don't worry. December. Mama, please unmute yourself. Don't join us here. December is our party. Don't worry. When I Victoria, we'll invite you also. Come and join us. It's gonna be loud. Oh my, loud. Don't worry. So Dr. Yokule, once again, thank you so much, sir. Thank you so much, sir. And everyone, have a great evening. Thank you, the management. Thank you, director. Thank you, Asada. Thank you, Dr. Benita. Thank you, admin. Thank you, head of BDM. Thank you. See you. Thank you, BDM. We'll see you. Thank you.
Thank you, doctor.
Yes. So
Thank you
so
so much.
admin, can you take your number on the chat room? Your numbers. Anybody that want to join the HMO, they can chat you uniquely. Please, admin, number on the chat room, please. All right, I'm good to go right now. So have a good night's rest, everybody, and see you at the top. Happy selling
All right. Good night.
and live long.